Hello and welcome back. Today we are going to talk about upper limb muscles and their nerve supply. First of all, we have the pectoral region. In pectoral region, we have the pectoralis minor muscle. We have the pectoralis major muscle. Other two muscles are the subclavius and serratus anterior. So these four muscles are included in the pectoral region. So now I will talk about their nerve supply. Pectoralis minor is supplied by the medial pectoral nerve. Pectoralis major is supplied by the medial as well as the lateral pectoral nerve. Subclavius is supplied by the nerve to subclavius, whereas serratus anterior is supplied by the long thoracic nerve. So now we will talk about the upper back muscles and the vertebral column muscles, which are included or they are related with the upper limb, and they include trapezius, latissimus dorsi. Then we have levator scapulae muscle, and then we have the rhomboid minor and rhomboid major muscle. So trapezius is supplied by the 11th cranial nerve along with fibers from C3 and C4. Latissimus dorsi, on the other end, is supplied by the thoracodorsal nerve, thoracodorsal nerve. Levator scapulae, rhomboid minor, and rhomboid major are combinedly supplied by the dorsal scapular nerve. So now coming to the scapular region, we have deltoid, which is one of the most important muscles of the shoulder region. Then we have the sits muscle, which are the supraspinatus. We have infraspinatus muscle. We have teres minor muscle, teres major, and we also have the subscapular muscle. Out of these, the axillary nerve supplies the deltoid as well as teres minor is also supplied by the axillary nerve. supraspinatus and infraspinatus both are supplied by the suprascapular nerve. Teres major is supplied by the lower subscapular lower subscapular nerve. The subscapularis muscle, on the other end, is supplied by the upper and lower subscapular nerve. In the arm, the muscles are divided into anterior and posterior compartment. In the anterior compartment, we have brachialis, biceps brachii, and coracobrachialis muscle. In the posterior compartment, we have triceps. All three muscles of anterior compartment are supplied by the musculocutaneous nerve, whereas triceps is supplied by the radial nerve. So further, we are going to talk about the forearm muscles. The forearm muscles are divided into the front and the back muscles. So the superficial muscles, so now we're going to talk about the forearm muscles. The forearm muscles are divided into the front or the flexors and the back or the extensors. So among the flexors, we further have two categories, which is the superficial and the deep compartment. In the superficial, we have pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. Some books add flexor digitorum superficialis into the intermediate layer, but it is for our convenience to remember it in the superficial layer. Then we have the deep layers among the flexors. There are three muscles which include the flexor digitorum profundus. We have flexor pollicis longus and pronator quadratus. Now, talking about their nerve supply, all the muscles in the superficial group among the flexors are supplied by the median nerve except flexor carpi ulnaris, which is supplied by the ulnar nerve. Whereas among the deep group, the medial half is supplied by the ulnar nerve, whereas the lateral half as well as the flexor pollicis longus and pronator quadratus are supplied by the medial nerve. So now talking about the extensor compartment. Again, extensor compartment is further divided into superficial and deeper. In the superficial layer among the extensors, we have an coneus muscle, we have brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris. Now, among the deep extensors, we have the supinator muscle, we have the abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus. So, among these first three muscles, anconeus, brachioradialis, and extensor carpi longus, are supplied by the radial nerve itself, whereas rest of these muscles, extensor carpi brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and all these deep muscles are supplied by the posterior interosseous nerve, which is one of the deep branches of the radial nerve. So here is one important point that these three muscles make the boundaries of the anatomical snuff box. So it is better to remember them in this sequence so that you can have easy. So now we're going to talk about the hand muscles. Muscles are divided now by thenar group, lumbricus, and the interossea. Among the thenar group, we have four muscles. We have the abductor pollicis brevis, flexor pollicis brevis, operans pollicis, and adductor pollicis. We have the adductor pollicis and abductor pollicis brevis. Among these three muscles are supplied by the medial nerve, whereas the adductor pollicis is supplied by the ulnar. Among the hypothenar group, we have the abductor digiti minimi, we have flexor digiti minimi, operals digiti minimi, and palmaris brevis muscle. All these hypothenar muscles are supplied by the ulnar. Among the lumbricals, the first and second, or the lateral two lumbricals are supplied by the medial, third, fourth, or the medial lumbricals are supplied by the ulnar. We have four dorsal antroci and three palmar antroci. All these are supplied by the ulnar nerve. So this sums up all the muscles with their respective nerve supply. Thank you for listening, and I would advise to make your own notes, and they will be helpful when we will be doing the MCQ series. So thank you very much.